In a previous video, I talked about how structures in the upper neck can become injured in the whiplash injury and why those injured muscles, tendons, and ligaments, and even nerve roots cause headaches. Pain radiates from back here, goes up to the back of the skull, can even give you a frontal headache. Well, this time I thought I would talk about how whiplash injuries to the middle and lower part of the neck can cause neck pain and also lasting neck pain and stiffness. In this book that I reviewed before, the author dissected over 200 human spines and studied them under thin slices, and he demonstrates the morphology of some of those injuries. Well, I thought I'd give you a little example, without showing the slides this time, of where those common whiplash injuries occur. So follow me to the lab. All right, so whiplash injuries. Here are the common injuries to the lower neck that you might have if that has happened to you. So what's causing the delayed neck pain? We're going to talk about that too. This is the side view of your neck, and notice you have facet joints back here. This is the back part of the neck. You have discs in front and ligaments in the front, the side, and the back. These ligaments hold everything together, along with the muscles, which you don't see right here. And then going down the middle of the neck is the spinal cord. You can't really see it on this view. But then you've also got these nerve roots that come out of the side, and those nerve roots will go down to the arms, the fingers. And so these are very functional, and they have certain patterns that are predictable. And for example, this C5 nerve root that comes out between C4 and C5, that nerve goes to the deltoid muscle and the biceps muscle. And so if that nerve is damaged, we can do a muscle test to the biceps muscle or the deltoid muscle, and it can correlate with some of the other findings like numbness and tingling in certain parts of the arm. And then at C6, between C5 and C6, the C6 nerve root will go to the biceps and the wrist extensors. And so a lot of times when C6 is injured, you might even get a tennis elbow because there's not a very good nerve root innervation to the wrist extensors, and that creates problems with the way the motors are firing and maybe inflammation at that site. And this is a very common area of injury, as we'll see. We're missing C7, but C7 does wrist extensors and grip strength. C8 does the finger flexors, grip strength. And then T1, between T1 and C7, that does interosseous muscles, finger spread and finger contraction back together. Now if we take a cross section of the neck, you can see there's the disc, there's the facet joints, articular pillars, but what's most striking here are the functional muscles of the neck. The muscles in back of the neck are way thicker than the ones in front. And so if you get hit from behind, there's not a lot of protection with the muscles in front of the neck. So you're going to get a hyperextension injury of the neck, stretching out the stuff in front, but compressing the stuff in back. And so some of the common injuries in the lower neck with a whiplash injury is this. So in the disc, as the disc attaches to the bone, that fast stretch can actually cause an avulsion between the disc and the bone, and that's called a rim lesion. That's going to cause bleeding between the bone and the disc, and it's going to bleed into the ligaments in front. Now in the back of the disc, you can have a herniated disc after an injury, and this can cause that same subligament bleeding that goes into the empty spaces in the veins just next to the disc. And so in the future, that's going to cause scar tissue. That's going to cause some buckling of the ligament, and the bone will become irritated. That's going to cause bone spurs. You can have bone spurs in the front of the neck and bone spurs in the back of the neck, depending on how the injury is. Now, because their muscles are so thick in the back of the neck and they're so thin in the front, you'll have an extension injury that will impact the facet joints. This is going to cause cartilage fracture, or maybe even a bone fracture in the back part of the neck. And even with a cartilage fracture, you can have free-floating fragments that go into the joint space, causing a lot more pain and problems in the future, as well as accelerated degeneration. Now, when you tear the muscles, you can also tear the ligaments. And if you're unaware of an injury, like someone's hitting you from behind but you weren't looking in your rearview mirror, your muscles don't have time to contract, to brace yourself from that injury. So you can have a ligament tear. The ligaments in the front of the bones can tear, and even the ligaments behind the bones can tear with it, causing maybe more of a catastrophic injury. You can have capsular compression, the capsule around the facet joints. They're kind of like the synovial joints in the fingers. And you can have capsular stretch, because if you go back in a whiplash injury, sometimes you rebound and go forward. The muscles will catch you back here. So these posterior ligament injuries are a little bit less common, but still you can have a fast stretch injury to the ligament between the spinous processes in the neck, or a ligament injury in the facet capsule. Now, so along with the ligament injury, it's easy to have a muscle strain injury. And the good news is muscles heal fast. But because the muscles are so thick in back and they're so thin in front, and you have that extension injury, the deep neck flexors in front of the bones, but behind the esophagus and trachea here, can become overstretched and injured. This causes bleeding. This can lay down scar tissue, and a lot of pain for a couple of weeks after a whiplash injury. At the same time, if you're unaware of an injury and you have an extension and a hyperflexion injury, you can stretch the muscles between the bones in the back of the neck too. And so over time, these injuries can cause scar tissue healing, bone spur deposits over the years, and it's very common for people coming into the office well after the injury is over to have advanced degeneration of the neck, where it becomes really stiff and susceptible to injury. So after an injury, it's very important to keep things moving. Chiropractic helps with this by identifying parts that don't move very well or parts that move too much. We identify instability problems as well as restriction of motion, and we use the proper modalities and proper exercises to help you heal from that process. So I hope that gives you a better idea of what might be causing your neck pain if you've been in an injury, a neck injury, a car accident, and why those injuries can have lasting consequences. Well, if you'd like to have more help with this, look up your local chiropractor who has a special interest in personal injury cases, whiplash injuries. And if you're in Petaluma, California, I'm Dr. Todd Lloyd over at the Adjust Clinic, and we'd love to help you out too.